How are you?
Good. My name's Bridget. I'm a PA student.
Hey, Bridget.
What's your name?
My name's Thomas.
Thomas? Nice to meet you, Thomas. So the plan for today is gonna talk to you about what's going on and then just get like a general idea of your health. So Thomas, what's your last name?
My last name is Bonanno.
Okay. And how old are you? What's your date of birth?
I am 30.
Okay.
My date of birth is 10/15/1988.
Awesome. And what brings you in today?
So I've noticed that I'm kind of getting short of breath a little bit easier, and I kind of have like a little pain, in the middle of my chest when I try to take like a deep breath. And yeah, I was honestly just gonna drink some water and continue with it, but my girlfriend was like, you might want to get that checked out, so I decided to get it checked out.
Well, I'm glad you came in because chest pain is not something we like to mess around with. So chest pain, chest hurts, and you got some shortness of breath.
Yeah.
Okay. So when did you notice that are the chest pain and shortness of breath together or two separate things?
Yeah, they're kind of come together. So like the chest pain is really only when I take a deep breath. So like I would say it's like pretty directly related.
Okay. When did you start feeling short of breath?
Oh man, I've been feeling short of breath for freaking 5 years, but like it really did get worse. I want to say maybe like a month, 2 months ago. It's kind of like gotten pretty progressively worse.
Okay. Do you notice any big changes in your life that might have made this worse?
Not really.
Workout routine, your job?
No, not really. Oh, I do work in construction. And there's always crap flying around in the air. And
Do a lot of lifting?
Yeah, a little bit of lifting. But I think I'm probably gonna start wearing a mask now because that may have been an issue in the past. It's just like so annoying to wear it at work.
I'm sure, but I'm sure you know this, but wearing a mask is good. You don't want to be breathing in anything that you're ripping up. You work on old houses usually?
Yeah, well we do a lot of refurbishing, so it could be, something new or it could be something old, but it's just we're working on making it different than what it was before.
Okay.
But yeah, I would say a lot of the places that we fix up they gotta be, anywhere from 50s, some of them the 60s.
You work with asbestos, anything?
I mean,
Probably.
we don't really test for it. My boss is not huge on spending money when we don't have to, so we just kind of treat everything like it's asbestos.
Alright, so I'm going to ask you some questions about your chest pain.
Okay.
What kind of pain is it, do you feel like?
It's like it's kind of like how do I want to explain this? It's like when I take a deep breath, it's like a needles in the end. It's like real tightness and kind of stabbing. But again, it's not like constant. And if I'm just breathing normally, it's fine. But if I take like a deep breath, then that's when I feel it.
Have you taken anything to make it feel better?
I mean, I take some cough medication, cold medication, but it doesn't really do a whole lot. That purple stuff that they sell at CVS, I take that.
Oh, like the NyQuil?
Yeah, it doesn't really do much, but.
Anything make it worse, like walking around?
Oh goodness.
moving?
Yeah, if I try to work out these days and I'm like trying to get my heart rate up, that's absolutely, I'm like puffing in 2 minutes.
And on a scale of 1 to 10, how bad is your pain
The pain isn't honestly that bad. The pain is like maybe a 4, maybe a 5 on exertion.
Okay. And for the shortness of breath, could you, how far can you go before you get short of breath? Like if you used to be able to walk, a mile, a couple blocks.
See. It's kind of hard because I don't exercise a whole lot anymore, but like when I'm out of sight, if I like go up the stairs and down the stairs and up again, like maybe 2-3 times, I start to really feel it then. Like one is usually fine, 2 to 3, I'm kind of pushing it. So I try to minimize how much I'm going up and down.
Have you ever had anything like this in the past?
I mean, I've always had a little bit of shortness of breath as far as I can remember. Even as a kid, I had a little bit of shortness of breath. I don't know.
Were you ever diagnosed with like asthma, anything like that?
No, I mean, I wasn't diagnosed. My mom has asthma, but
Okay.
I don't know. I didn't really go to the doctor much as a kid, though.
So, any associated things coming along with this pain, shortness of breath, like?
Yeah, every once in a while I'll cough up. You know, cause it's almost like the shortness of breath. Sometimes we'll get a little coughing with it. I'll cough up, and it's real gross when I cough up.
You cough up like mucus or something?
Yeah, a little bit of mucus.
What color is it?
It kind of depends. Usually yellow or green, though. It's not the greatest situation. I don't know. I drink a little water and spit it out.
Gotcha. Okay. Any sort of fever, chills?
No, not with this anyway. I mean, I get a fever every once in a while, but not now.
Do you have any weakness associated with it?
Not really, other than the fact that, like, yeah, if I get short of breath, I gotta stop, just calm down and freaking sit down for 2-3 minutes, something like that.
Okay. And have you noticed any weight change?
No.
Clothes fit tighter, looser?
No, nothing like that.
Okay. Alright. So just so I can kind of get a whole picture of your health, since this is the first time I'm meeting you, I'm going to ask you some questions about your whole medical history. Do you take any medications?
Yeah, I take, oh gosh, what's it called? I have high blood pressure, and I take one of those.
Okay.
I think they call it a statin or something like that.
Alright.
I forget, though.
We can check on that later. Do you take it once a day, twice a day?
I take it once a day. It's just, one time.
Okay. You don't know the milligrams or anything like that?
No, I know it's like a red capsule, though. It's like a red one.
Okay. Any other meds?
No, not really. I take a vitamin. I take one of those, we got the Fred Flintstone gummy vitamins in the house. I love those.
Take those once a day,
Yeah,
just for general
that's just
health?
once a day.
Okay.
Oh, I also take biotin. Someone told me it was good for the skin and hair.
Okay. And any other over-the-counters, vitamins like that?
Not really. I mean, I take that cough medicine like pretty often, but it doesn't do a whole lot.
And you said it's the
It's the
NyQuil?
Yeah, I think it's called NyQuil. It's whatever that purple liquid stuff is.
Okay. And how often do you think you take that?
Man, I've been taking it more recently just because I've been on a bad spell. But I don't know, probably
Every
like at least
day?
twice or 3 times a week.
2 to 3 times a week. Okay.
Yeah.
Are you allergic to anything?
Not that I know. Oh, I do have like a peanut allergy.
Yeah?
But I just avoid that. I don't really encounter that much. I also do have like in the springtime, sometimes I'll get like itchy eyes, but that's about it.
Okay, some seasonal allergies.
Yeah.
What happens when you have peanuts?
So I haven't had it for a while because I've just been avoiding it all my life. But my mom told me that as a kid, I kind of like broke out in like red blotches. I got kind of like a raspy voice.
And you just avoid them pretty well?
Yeah, I mean, she took me to the hospital then, and I guess everything was fine. But now I just, if it ever says may contain peanuts, I just say it's not worth it, honestly.
That's a good practice. Now I'm going to go into a little bit about your childhood. So, how would you describe your overall health as a child?
It was pretty good. Sometimes I wouldn't be able to keep up in sports with the kids because I would get a little bit of short of breath. I think this is kind of like what that is. It's just like kind of been all my life. My lungs haven't been too great, honestly. But other than that, pretty healthy kid. Had chicken pox.
Chicken pox?
Yeah, I think I was like 4 or 5.
And anything happened? You just...
No, it was, I mean, it was pretty awful. I don't remember a whole lot from it, just remember being in bed.
Anything like result after that, like, or did it just kind of go?
No, it kind of resolved itself.
Okay.
I think my mom got me something from the doctor, and I just took it and it went away.
I'm gonna ask you about a couple specific illnesses that you could have possibly had as a child. Just if you remember, did you have the measles ever?
No.
Mumps?
No.
Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No, but my grandma had polio.
Okay. We'll touch on that in a little bit. And were you diagnosed, or did you have any interactions with psychiatric professionals?
No. My mom did say that I was a little hyperactive as a kid, and I talked to some people at my church as a kid, but that was not medical or anything.
Okay, never a formal diagnosis?
No, just going in and talking with people.
Alright, and now I'm going to ask you about some vaccinations most kids get. So, do you remember getting a polio vaccine?
Yeah, of course they gave me it.
And MMR?
Yep.
Mumps, measles, rubella, that
Yeah, I got those.
And there's the Haemophilus influenza type B.
Couldn't tell you on that one.
Okay. And tetanus, diphtheria, and pertussis usually comes as one whole vaccine.
Yeah, I actually, it was like 2 years ago while I was on a construction site. I was walking around and somebody had left, like a plank facing up, and there was a nail coming out of it and it was rusting. It went straight through my freaking boot. Yeah. Anyway, they just kind of re-upped me on everything for that.
Yeah, that's pretty common. Usually you get those every 10 years or so
Okay.
you're good for a little bit now if it was only 2 years ago. Did you have the hepatitis B vaccines?
Yep.
Rotavirus?
Maybe. I don't know about that one.
Okay, we'll check on that one. Chickenpox? I know you had the illness. And then the pneumococcal?
Again, I'm not sure on that one.
Okay. And as an adult, how would you say your overall health has been aside from this coughing?
I could exercise more. I could probably eat better. Put a little more thought into my diet. But generally, other than this, it's pretty good.
Pretty good?
Say. It's
All
okay, at least.
That's something we can discuss later if you want to. Some diet changes, lifestyle changes. I'm just going to ask you about a couple specific illnesses or diagnoses you might have had as an adult. Any sort of thyroid disease?
No.
Any sort of heart disease or coronary artery disease?
My dad has AFib, and so they're worried that I'm gonna have AFib, but nothing so far.
Okay. Myocardial infarction, also known as heart attack?
No,
Nothing
never.
like that? Angina, which would be you have pain when you're exercising in your chest?
Yeah, I do get that a little bit. Again, if I'm really puffing away, then I'll get a little bit of that pain kind of in the center.
Sure. And have you ever seen the doctor about that before?
It's a little bit of why I'm here. It's kind of secondary reason why I'm here today. Not as important, but
Not
still.
as important as the cough. All right. Any sort of diabetes?
No.
Lung disease?
Wow.
The asthma?
Yeah, my mom has a history of asthma, and I haven't been diagnosed with anything like this yet, but my grandma, she died of lung cancer. She was 67 or something like that. And my mom has emphysema as well as asthma. So It runs in the family, and I think they're looking for that, but I haven't gotten anything yet.
Okay. Have you ever had any sort of renal disease?
No.
Cancer?
Yeah, well, not me personally.
Not you personally, okay. Any HIV?
No.
Hepatitis?
No.
Or blood clots?
No.
Okay. Have you been in any accidents or been injured in any way? I know you worked with.
Well, there was the one time with the nail that was, I want to say 2 years ago again.
Okay.
See, that would have been, 2017?
And did you go to the hospital?
Yeah, they stitched me up. They actually had to pull the nail out because I couldn't get it out on my own, so they had to saw the board on both sides. It was bad.
Oh man, sounds like it was a pretty rough experience. I'm sorry you had to go through that.
Yeah, it went through the other side of my foot. It was actually, it was crazy. It hurt like a freaking, it hurt a lot.
And any sort of complications with that?
No, I think they were worried for, the rust, but everything was good. I got my vaccine and all that.
Okay. And any other accidents or injuries you can think of?
Yeah, as a kid, I broke my ankle.
Okay. What year was that?
Okay, let's see. I would have been 10, so that would have been 1998. sometime in the summer of '98.
And did you have to have any surgeries, or did they just cast it?
They ended up casting it. Yeah, it was like a accident where it fell off one of the jungle gym and I just landed on it all kinds of wrong. But I just kind of like, it kind of sucked. I was in a boot for the rest of the summer. But,
That would have been pretty bad.
Yeah, it wasn't the greatest.
And no like complications from that?
I mean, I still, honestly, so it never healed fully right. And they said that I'm like a little shorter in that leg, so I always have like a little bit of a limp. But honestly, I'm pretty good. I mean, I'm not really the kind of guy who exercises a whole lot anyway.
Okay. And have you ever been hospitalized?
So let's see. I wasn't overnight for that. No, not that I could think of.
Okay. Have you had any surgeries?
No. Oh well, actually, I did have my wisdom teeth out.
Oh,
That was
okay.
when I think I was like 20, 21, something like that.
Do you remember what year that was?
That would have been, let's see, 2008 or 2009.
Okay. And did you go to like a outpatient kind of deal, or did you go to the hospital?
Yeah, it was like God, I forget what they call those things. It was like maxillofacial, something like that.
Mhm.
But anyway, it was totally outpatient. We just went there. They took out this bottom left one and the top right one, because those were the only ones that were like impacted or something like that. I forget.
Yeah, impacted. And who did the surgery?
Oh gosh, Dr. Jory. It's Jhori. He's a pretty nice guy, honestly.
Any complications with that? Infections or pain?
No, honestly, they healed up just fine. I was like back at it the next day, and they gave me like all these meds and stuff, and I didn't even end up using them because it was like good. And it healed up real.
That's always good. And now I'm going to ask you about some health maintenance things. So, have you ever had a colonoscopy?
No.
Have you ever had a fecal occult blood test?
I don't even really know what that is. Is the thing.
Okay, that's just a test that sometimes we give people. You're still a little young, we're 30, just to see if there's any blood in the stool.
Okay. Yeah. No.
Leads to
Never.
further testing.
Never anything like that.
Okay. Ever get like a blood panel done to check for any high cholesterol?
Yeah, my dad has high cholesterol, so they checked me for high cholesterol. It's gonna be twice now that I've gotten it. Once when I was like 20, once when I was 25, both fine.
Both fine. Okay. And do you get any of your adult immunizations, like the flu shot every year?
Yeah, make sure I get my flu shot. My mom's big on that.
Yeah, it's a big one. Have you gotten like the herpes zoster?
Yeah, they did give that to me because I had chicken pox.
Okay. And how about the pneumococcal shot?
Can't tell you.
Okay. And how about psychiatric history? Have you ever made contact with a psychologist?
No, other than that counselor as a kid, like the church counselor, that's about it.
And have you ever been hospitalized for
No,
anything
nothing like
psychiatric?
that.
And since it's such a common problem in our society, have you ever felt the need to hurt yourself?
No, thankfully I'm good with that.
Any sort of suicidal ideation?
No.
Ever
nothing
wanted to
like
hurt anyone else?
that. I mean, I was a little bit of a bully as a kid, but I never really hurt anybody. It was more like, poking fun and that kind of thing.
Okay. And now I'm gonna go into your family history. So, overall, how healthy, unhealthy is your family, would you say?
We're all kinds of unhealthy. I mean, my mom's got, lung problems for days. My dad's, he's got some problems with like hypertension. He's got high cholesterol. He's, pretty chronically obese. It's not a great situation, but
Do you have any brothers and sisters?
yeah, I've actually got 5 brothers and sisters. I come from a big family.
Okay. So, are
Right.
you in the beginning, or middle,
I
end?
got 2 older and 2 younger.
Okay, so who's older?
So my older siblings are Rebecca, and she's, how old is she? She's 36. And Matthew is 34. He's gonna be 35 soon.
And then it's you.
Yep.
And then who's
And below me, I got Elizabeth, and And Elizabeth, she is 27. And then there's John. I think he was an accident because he's only 16 years old.
Okay. And so you said your mom has emphysema, some lung issues. Anything else you can think of? AFib, you said also?
Yeah, she's got no, my dad's got AFib actually.
Oh, okay.
My mom, she's got, the emphysema, she's got the asthma, she's just coughing all the time. She's got a chronic cough. She also has, arthritis, they call it,
Rheumatoid?
Yeah, rheumatoid arthritis, that's the one. They diagnosed that, she got that like maybe 2-3 years ago. So she's on meds for that as well.
And you said dad, anything else going on with dad?
No, not that I can think of.
Okay. And how would you say your siblings are health-wise? Pretty young.
John's probably the healthiest out of all of them, the youngest. He's pretty good. Matthew, my oldest brother, he's got problems with a little bit of mental health issue. You know, he smokes a decent amount of weed, and I know that's not good for him. But other than that, he's kind of a bit of a loner, but that's it.
Okay. You said mental health issues. What would that like?
Yeah, I think depression and anxiety, or maybe depression or anxiety. I don't talk to him a whole lot about. He's pretty quiet. You know, he keeps to himself about all that.
Okay. And how's Rebecca?
Rebecca, she's in pretty good health. She's had diabetes, but it's type 1. It's under good control.
Okay. And Elizabeth?
No, nothing I can think of.
Okay. And I just want to touch on your grandparents.
Oh yeah. Okay, so my mom's mom, she had a history of lung cancer. They told her she had oat cell or something like that.
Okay.
And yeah, she died pretty quick after that. That was like 67, I think she was. Other than that, I don't remember a whole lot about my grandmother, my maternal grandmother. My maternal grandpa, he's still living. He's got some issues with dementia. He's kind of a little bit off the deep end at this point. But other than that, pretty good. He has leukemia. Oh, he's 81. He's 81. And he's got issues with leukemia, but they said it's like not a big deal. He's like all fine. It's like chronic or something.
Okay. And then how about your paternal grandparents?
So they both died before I was born. My dad's dad, he had a heart attack and he died at 55, so he's pretty young. I think he also struggled with obesity. I'm not really sure. My dad's mom, honestly, I don't think my dad's mom had any problems.
Okay. And then all these people are your biological or any sort of adoption, anything like that?
Yeah, well, that's the thing. So my sister, Rebecca, she's the only one who's adopted.
Okay. And your parents are your biological parents?
Yeah, my parents are my biological parents.
Okay. And I'm just going to ask about some specific things that families might have. If you could think of anything. Any sort of headaches?
Oh, you know, now that you say it, my other sister Elizabeth, she gets chronic migraines, but she's the only one in the family, so I don't even know how that happened.
Okay. Any sort of renal disease?
No.
Any other cancers than the lung? I see some.
Yeah, my grandpa, he died of leukemia.
Your paternal grandpa?
Yeah. He passed, but other than that, no.
Okay. And anyone else with any diabetes, like type 2?
No one had type 2.
Any sort of...
Actually, my dad's dad may have also had type 2 now that I think about it.
Okay.
But again, he died before I was born, so I don't really remember a lot about that.
And what about any sort of heart issues? Like anyone have like a heart attack or coronary artery disease?
Yeah, my dad's dad died of a heart attack, but I think that was the only thing.
And anyone with hyperlipidemia other than your father?
I think he's the only one. My brother gets tested,
Okay.
but I think he's snag as well.
Any sort of asthma and COPD? Anyone else you can think of?
Yeah, so my mom, I think they call it emphysema, but I thought it was also I don't really know how that works.
Yeah, it's COPD is sometimes a word they use to describe a couple different
Gotcha.
conditions.
Yeah, well, other than that, I mean, I'm guessing my grandma had it as well.
Okay. And anyone with any thyroid issues?
No.
Anyone with any renal disease?
No, I can think of.
And I know you mentioned your brother had some mental health issues. Does anyone else have any mental health issues?
No, not that they've told me, but we kind of keep to ourselves a little bit, honestly.
Any sort of substance use issues in the
No,
family?
thankfully not.
Alright, now I'm going to go into a little bit of, that's actually it.